What do inconsistent rheumatoid arthritis blood tests mean? Imagine trying to solve a puzzle where some pieces fit perfectly, but others seem to be missing or don't quite match. That's often what doctors face when interpreting blood tests for rheumatoid arthritis. Blood tests are important tools, but they don't tell the whole story. When results are inconsistent, it can be confusing, but it's a common part of understanding this complex disease. In rheumatoid arthritis, the two main blood tests used are rheumatoid factor and anticyclic citrullinated peptide antibodies. Rheumatoid factor is an autoantibody found in most people with RA, but it can also appear in other autoimmune diseases, infections, or even in healthy older adults. Anti-CCP antibodies are more specific to RA and are present in many but not all cases. Some people with RA test negative for both, which is called seronegative RA. When blood tests are inconsistent, it usually means one of a few things. Sometimes, a person may have symptoms and joint damage consistent with RA but test negative for these antibodies. This doesn't mean they don't have RA, it just means they have a subtype called seronegative RA. Other times, test results can fluctuate over time. For example, rheumatoid factor levels might be high at one point and then lower later, or vice versa. These levels can sometimes stay elevated even if the disease is less active, so they don't always reflect current inflammation or disease activity. Additionally, elevated rheumatoid factor or anti-CCP can occur in other conditions like lupus, infections, or even with aging. Early in the disease, antibody levels might not be high enough to detect, especially if the disease is mild. That's why blood tests are just one piece of the puzzle. Doctors also look at symptoms, physical exams, imaging tests like X-rays or ultrasounds, and other markers of inflammation such as ESR and CRP. These help build a clearer picture of what's happening in the joints and body. If blood tests are inconsistent, it's important to remember that diagnosis and management relying on a combination of factors. A rheumatologist will consider all this information to decide if someone has RA and how best to treat it. For some, monitoring symptoms and imaging over time is more helpful than relying solely on antibody levels. This approach recognizes that RA can present differently in each person and that tests are not infallible. In summary, inconsistent rheumatoid arthritis blood tests mean that the typical markers may not always align with symptoms or disease activity. It's a reminder of the complexity of RA and the importance of a comprehensive, personalized approach to diagnosis and treatment. Always consult a healthcare professional for an accurate assessment tailored to your specific situation.